Okay. Okay, we did it. Hi there. I see there are a few people in here, and I want to say hello and welcome, and I'm just going to jump right in and get started. So, hello, my name is Lisa. Maybe we've met before, maybe we haven't. You might know that I am the daughter of Dr. Geringer Woititz, who is the author of Adult Children of Alcoholics and known as the mother of the recovery movement for adult children of alcoholics. And my work, Unwelcome Inheritance, follows hers. And then there are all of these other books in between. And so my responsibility and my job here is to offer to you all of the content that I have. And then tomorrow we're going to start digging into the books. But for tonight, I just wanted to, I had a message, I guess I would call it, something that's been rattling around in my mind and coming up over and over and over again lately. So I thought I would come in and talk to you about it. And the way that I'm going to do it is that I'm going to go through my notes here and explain to you this idea that I want to talk to you about, which is baggage. And then I'm going to go through the comments and respond to the comments at the end, because I'm very distractible, and I've been told that it is super annoying when I'm talking to you and then looking at comments and going back and forth, and then I lose track of what I'm saying right on camera, and I can't remember where I was. So, okay. Here's the thing. Maybe 3 times in the past week, I have spoken to people about this very same idea of not being able to address problems in the moment that they're happening. And what I want to say about this is that this is baggage. Baggage is not the same thing as trauma. What's the difference? Trauma, I can think of 2 examples of trauma. Trauma can be acts of God that we go through. Maybe we live through a fire or a hurricane or a terrible accident. It's something that has been inflicted upon us where we are powerless and we really have nothing to do with it happening. Or trauma can be a situation where there's an imbalance of power, and somebody with much more power than us has inflicted harm. So that's my definition of trauma. Maybe there are other things that could go along with that I'm not thinking of right now, but it's just to illustrate that that's a different idea than what I'm talking about now, because baggage is different. We have more control over that, and in my definition, baggage is something that we can put down, right? Baggage many times has to do with resentment, which is different than anger. Resentment is anger that lingers. Okay, anger is something that we feel in the moment, and resentment comes when we don't address anger and we carry it forward. And so that is a lot of what baggage is. Okay, it's resentment that we carry along with us because we don't address it in the moment. Or baggage can be fear, right? They're unresolved things. So baggage, you can put it down, but maybe you can't find a proper place to put it down. In other words, it's hard to find a perspective on things that is different than the one that we've held forever. And so we can't find a proper place to put this down. Maybe you don't realize you're carrying it, right? Sometimes we're acting out of our baggage and we don't even realize it until maybe something happens and we have a light bulb moment, or somebody points it out to us and we are able to see it. Sometimes we're afraid to put down our baggage, right? We're just so used to holding on to it. Like, for example, anger at your parents. I propose to you, because this is a lot of the work that we're going to do, is that maybe letting go of anger at your parent or parents is something that causes a lot of fear because of all of that emotion that goes along with it. And then who are we without that, right? Who are we without that story? We don't know how to think of ourselves. So we don't know who we are without it. So that's more of an idea of what baggage is. So it comes from, in large part, and this is my observation over many, many years and speaking to many people, that it comes from not addressing something in the moment, right? So something happens and we minimize it. It's not a big deal. I'll let it go this time. Or maybe we'll have feelings about it and we'll eat those feelings, or we'll smoke a joint with those feelings, or we'll go shopping, or use some other kind of substance, or I don't know, maybe some kind of healthy habit, maybe go exercise it or something, or do something that's maybe self-destructive. So we carry it forward. And that's why my mom always said, she had this saying, keep it current. So if you were acting out of your baggage, like sometimes you can just clearly see, right? Somebody is reacting to something and you just know the reaction is, it just doesn't match up to the situation, right? It might be baggage. And so my mom always said, keep it current. In other words, deal with it in the moment. Whatever baggage you have back there that hasn't been dealt with, bring that forward, deal with it, and then from here on in, address things in the moment that they're happening, and don't create more baggage, right? Easier said than done, I know. So if you're in a 12-step program, that's what the 4th step does, right? It clears out all the baggage in the past, all of the resentment. It addresses all the fear. It identifies all of the ways in our current life that we are reacting out of those things, right? And then we have maintenance steps where we look at our day every day and we say, okay, what do I need to fix? What do I need to, what could I do better? And we address things in the moment that we're happening. So why don't we do that, right? It seems like such an obvious thing, but like I said, much easier said than done. So for many people that grew up in alcoholic households or households with similar dynamics, you probably never had a voice or a say or a vote about anything, right? So using your voice is not something that you really ever did. So what would you say, and how would you say it? And how do you know if it's what you say is appropriate, or is your reaction overboard, right? We just don't know. This is part of what many folks did not learn growing up, is this kind of healthy communication and addressing problems. And addressing problems with other people, especially when the problem has to do with that other person. I think that's the most intimidating. Why? Well, for many, there is a fear of confrontation. So that even if this thing that we're addressing isn't such a big deal, put the cap on the toothpaste. It's not a big deal, but inside it feels like a very big deal. Inside it feels like a confrontation. And we don't know what will happen, right? Will there be violence? Will somebody be violent toward me, or will I be so angry myself that I'll lose control of my anger? Because for many adult children of alcoholics, anger equals rage. Like it goes from 1 to 100. There's nothing in between. Maybe we're afraid of that loss of control, or we're afraid of rejection or abandonment, or for many people, as we get healthier and we start to use our voice, the people that are used to us always saying, oh, that's okay, or they're used to us not confronting any issues, they will think we have completely lost our mind. And you know what? That's okay. You can expect that, and everybody will get used to this as you become consistent. So I wanted to give you a couple of examples that were given to me over the past week, and I think that you will be able to identify. Last weekend, I had a great talk with a treasured old friend, a childhood friend, and we're talking about a situation with their spouse who makes these kind of digging remarks, like kind of throwing darts. And so there's this pattern of the spouse throws a dart and my friend is just used to it. No big deal, whatever, there they go again, and doesn't address it. And the thing is, it doesn't go nowhere. And what do I mean by that? Right? If something seems small and petty and we brush it off, it doesn't go away, right? We stuff it in. And then we start to resent that person, and then maybe we feel bad for resenting somebody over such a dumb thing. But like I said, resentment is anger that is continuing on and on and on, right? It's a chronic thing now. So it's not just what happened then, it's all the other shit that happened too, and now it's happening yet again, and this is on top of everything else. So it's different. And so we talked about, what is this not saying anything? What is it? And we came to exactly this. Well, what if, right? We ask ourselves, what if? What if I did say something? What would happen? What would that other person say? Would they tell me to go F myself? Would they punch me in the face? Would they leave me? What would they do? Right? Is this a real fear? Or is it just a fear based on the anxiety that we feel inside? So what we fear will happen, what we are feeling inside don't necessarily match up to the situation. So, okay, so is that something that would happen? If I say, if somebody says something really inappropriate and hurtful to me, I can say, I can say something really disgusting back to them, right? There's a truck driver that lives inside of me that, I'm from Jersey. I know how to curse. I can respond like that, or I can say, ooh, that hurt. Right? There are different ways that you can respond, and that other person's reaction is not our responsibility. That's their responsibility. So you say something that's hurtful to me, and then I say, in the moment, wow, that really hurts. And then whatever they do is up to them. Will they fly off the handle? Okay. Will they say, oh, I'm sorry? Maybe. We don't really know. But however it unfolds will either show us, wow, this relationship is, kind of broken here. There's some problems here. Or maybe it will deepen your relationship because you've actually communicated about something and had to follow it through to the end and have to communicate about what's going on with you so that other person can understand, right? So what we are afraid of happening is not necessarily what's going to happen. And if it is, then that's something that needs to be addressed also. So I always say what you mean, but don't say it mean. And this is scary, addressing things in the moment. I don't minimize it because for most of my life, I've been absolutely terrible at it. But I can promise you one thing, that when you start to do this, instead of being chronically an anxious person, that anxiety that you've been living with all of your life will begin to dissipate. I promise. It's going to be amazing. So say what you mean, but don't say it mean. Another quick example is a close friend of mine, home in quarantine, and the kids not really helping out very much. I don't know. I mean, they're grown adults and not being helpful, really kind of high maintenance. Now, mom has always catered to everybody. Mom has always cleaned up after everybody. Mom has never said anything. And you think that your kids are adults now, that they should know better. Well, how do they know better, even if they're adults, if we never taught them that? So we can teach them that now. We can say, kind of neutralize it so that we're not being confrontational or overreacting, because it's not just today, right? It's all the times that they never helped before that, and now this is just the straw that broke the camel's back, right? So you can say, you know what? I know I never said anything about this, but this is what needs to be done, and this is how it needs to be done. We can just be neutral and just deal with it in the moment. So I encourage you to just give it a try. And little by little, it's going to get easier and easier, and you will become much freer. And, we'll talk about these things as they come up. So that's what I wanted to say to you today, is to encourage you not to create any more baggage. We're going to get going, and we're going to start digging deep into the rest of the work. And this topic, as well as many others, will be addressed. But this is one of the biggest things I see. And all of this, 90% of what we're going to be talking about comes from low self-esteem. It comes from not valuing yourself the way that you deserve. And that's something that was learned very, very early on. So that's what I got. So let me see if there are any comments in here. And then just give me a second to figure out what am I doing. If you guys saw my process that I have going on here, getting these things set up and organized, you would think it's scary in here, I promise. Okay, let's see. Oh, another thing I wanted to say is that I'm not going to say names when we're on a live, and then I'm not going to leave this video up here the way it is. Because if I leave it up here and other people look at it, then they can see who was here. It's a privacy thing, in other words. So what I'm going to do is I'm going to download this video, and then I'm going to load it onto YouTube, and then I'll put the link back up on the page. So you'll have this video, but you won't see all the comments. So you can expect to see the video, and however much time it takes me to figure out how to do it. I'm getting pretty good at it, but it's still pretty bad. Okay, so, okay, hello and good evening, and good definition of trauma. Okay, let me know if I missed anything, and this was helpful. Okay, and let's see. I don't know if I can't see anything else, or I'm scrolling down and I don't see anything else. So I don't know. I hope I'm not missing anything. Okay, so if you watch this on the replay, or if you're watching it now, feel free to please send me any questions or comments. Send them to this Facebook page, in the private message thing, and then I will either respond to you directly, or I'll come back on in another video and address what you said. This is very good. Okay. All right, cool. Okay. So that's all I have right now, but I will be back tomorrow, and now that I've said it to you, I know I'll actually do it. So I appreciate you stopping by, and you can come back and watch this and the other videos here on the page, or watch them on YouTube. And please like and subscribe and do that stuff so we can kind of build that channel and I can get all of this out to as many people as possible. Okay? All right. Thank you so much. Everybody be safe. And I don't know about you, but I'm ready to meet my hairdresser in a dark alley somewhere and take care of this. Anyway, I hope everybody's being safe, and take it easy, and looking forward to seeing you tomorrow. Okay.